So the CDC is scaling back how it tracks foodborne illnesses, meaning fewer outbreaks are officially recorded, even as the risk remains. Funding cuts and program rollbacks are leaving gaps in the nation's food safety net. Let's get some answers on this. Got to talk to our good friend Juan Leon. He's the associate professor at Emory's School of Public Health there. Bottom line, Juan, you know, are we that much safer today, or are we just flying blind here? Talk to me.
Great question, and thanks for having me here. You're absolutely right. We need to be concerned. Our foods are less safe because we're no longer tracking these important diseases. FoodNet is an important safety surveillance system that tracks diseases and is a model for the rest of the world. We're no longer doing that, so there's a lot of diseases that we're no longer tracking, and therefore we can no longer prevent and reduce the impact of outbreaks in causing illnesses, in causing hospitalizations, and heaven forbid, causing deaths.
So what does that mean for us, right? So for a family in Georgia, you know, if we have fewer outbreaks officially tracked, could something slip through the cracks or something that we don't even know about and we just kind of get sick? I mean, talk to me about that.
Yeah, absolutely. So the great thing about FoodNet is that because it's at the national level, it's able to collect information from different states. Each state protects its communities in different ways, but we need a good way to standardize it and make it easy for all states to collect this information. So when an outbreak happens in Ohio, and it may also happen in Georgia, both Georgia and Ohio state health departments can quickly access that information from FoodNet to protect its communities. With FoodNet scaling back, this will be harder to do, and therefore outbreaks will be harder to prevent and also to stop.
If something happens as a result of the food we eat, right, does that mean it's going to take longer to connect back to the source because you don't even really know what you ate or something like that? I mean, could that be the case?
Yeah, you're exactly right. FoodNet is a fantastic tracking system that is high quality because what FoodNet does is it contacts state health departments, hospitals, a lot of different individuals, and checks the quality of its information. So when people go to FoodNet, they know they have a trusted source. And they know they have a trusted source to learn more about the outbreak, whether it's a baseline level of diseases or whether it's behavior patterns of different communities, such as vulnerable children, older adults, women who are pregnant. And without this key information, all these vulnerable groups, as well as our communities and you and I, will be less safe.
What about on the lower level, right? How big of a setback is it for our, like, State Department of Health? How much of a big delay would it be for them?
The delay will involve a lot of people time because state health departments will have to, one, double check the information that they have, two, reach out to other state health departments. Other state health departments will also have to check their information, return the information back. And that is precious minutes, hours, days, weeks that are lost. And meanwhile, people are still consuming the unsafe foods and getting sick and getting hospitalized. So FoodNet prevents all that by standardizing it, making it very easy to access that information through dashboards, making it easy to collect that information and synthesize it so state health departments and the food industry can take rapid action and protect all of us.
Should lawmakers be worried about this as far as a short-term budget fix that creates a long-term health cost?
This is an excellent point. You can think about it as during flu season, we end up firing all the doctors and nurses. So it saves money in the short run, but in the long run, then who's going to be there to treat people? And it's going to be very expensive then to treat and save all these people that are there. Because we're cutting FoodNet and other programs like FoodNet, we're doing the exact same thing. We're blinding ourselves to information that is critical for us to prevent diseases, to make our food safer, to make our communities healthier. And at the long run, it's going to cost more, but at the end, the price of one life or one hospitalization or one illness cannot be measured. So we are doing a great harm to our country.
Professor Juan, I have one more question for you. We got about 15 seconds left. What signs should someone look out for if they think they have a foodborne illness and it's not just a stomach bug? What do they do?
Generally, the typical ones that all you and I have had in terms of vomiting and diarrhea the last several hours is something to be of concern.
Mm-hmm. All right, very good. Professor Juan Leon, thanks so much for joining us. Thanks for your insight. Really appreciate it.